For decades, the standard response to acute social crises, like chronic homelessness or children entering the foster system, relied on emergency interventions: a hot meal, a temporary bed, a reactive patch on a much deeper wound. But state governments and federal agencies are no longer funding good intentions alone. To secure operational licensing and critical funding today, nonprofits are required by law to provide hard, third-party proof of their clinical outcomes. This regulatory pressure has elevated the Commission on Accreditation of Rehabilitation Facilities, or CARF, into the non-negotiable international standard for operational excellence in human services. The CARF framework forces these organizations to look entirely inward. The evaluation demands that nonprofits track data, mitigate risk, and operate with the exact same logistical rigor as highly sophisticated corporate entities. Relying on a heartfelt mission statement is no longer an option. If an organization cannot deploy a verifiable, data-driven framework to prove its success, it simply will not survive the modern philanthropic landscape. Look at Hope Services Hawaii. Their stated goal is to make homelessness rare, brief, and non-recurring, and they achieve this by deploying highly specialized clinical interventions right at the street level. Their operation is anchored by a housing-first model. Instead of demanding psychiatric compliance or sobriety before offering help, they prioritize giving people a permanent, secure home immediately, creating a stable physical platform for long-term recovery. They pair this housing strategy with a mobile street medicine unit. Registered nurses and psychiatric providers travel directly into encampments, bringing wound care and vital medication management to individuals who could never access a traditional clinic. This chart shows the tangible result of that methodology. In a single fiscal year, 74% of the individuals Hope assisted successfully transitioned into permanent housing, and of those placed, an astonishing 93% remained securely housed 2 years later. Treating housing stability and clinical healthcare as inseparable, synergistic interventions drastically outperforms the old, fragmented benchmarks of social work. That same demand for absolute structural precision applies to the child welfare system, where organizations like Koinonia Family Services operate under intense public and regulatory scrutiny. They manage exceptionally vulnerable populations, youth with complex medical needs or severe developmental delays. Instead of placing these children in institutional wards, Koinonia strategically places them with specially certified resource families wrapped in a 24-hour network of clinical and crisis support. They even run targeted initiatives like Project Keep Say, a specialized 16-week curriculum designed specifically to lower caregiver stress and prevent the trauma of a failed foster placement before it happens. By building these proactive, trauma-informed support structures, they are actively engineering systemic resilience rather than merely warehousing vulnerable youth in the system. Delivering these life-saving outcomes requires organizations to survive a notoriously demanding 5-stage operational marathon to earn their CARF accreditation. The most grueling phase is the 6-month conformance runway. Agencies must operate in strict, documented compliance with all CARF standards for half a year before their scheduled audit, entirely precluding any performative last-minute policy assembly. This is followed by a multi-day on-site survey, where practicing industry professionals scour clinical records and interview vulnerable clients to verify that administrative policies are actually being lived out in daily practice. Surviving this gauntlet permanently shifts an agency's posture. They move from reactive crisis management into a highly modernized state of proactive, continuous quality improvement. But there is a logistical breaking point. Attempting to manage these relentless demands using disconnected spreadsheets and scattered emails inevitably causes administrative collapse. This is a look at Hibox, a unified operational ecosystem explicitly built to handle the staggering complexities of nonprofit program management. The platform acts as a single secure environment to centralize entire client life cycles, automate complex volunteer schedules, and meticulously track incoming grant pipelines. It even features a built-in learning management system, giving agencies a direct way to solve those stringent CARF compliance requirements for ongoing staff training. Managing these multi-layered clinical mandates requires a level of organizational oversight that legacy tools like standard spreadsheets were never designed to provide. This table breaks down the ultimate return on investment. By unifying workflows, organizations gain up to 16 extra hours per week per user for direct mission work. Notice the massive reduction in hours spent wrangling emails and files, administrative overhead converted directly back into frontline service delivery. Operational efficiency serves as the engine for direct impact. It buys back the time necessary to provide the high-intensity care these clinical standards demand. To empower your mission and unify your organization, schedule a demo today at hibox.co.